By JILL LAWLESS, Associated Press Tourists and the travel industry vented frustration and anger on Saturday after Britain reversed a plan to ease travel restrictions on France just 2 days after they were due to start, citing concerns about a variant of the coronavirus. The move comes despite the fact that France currently has lower rates of the virus than the UK, where the highly contagious Delta variant is driving a surge in infections. On Saturday, Health Secretary Sajid Javid, who is in charge of Britain's coronavirus response, said he has tested positive for COVID-19 and is self-isolating while he awaits the results of a second test. Javid said in a video message that he has had both shots of a vaccine and, "So far my symptoms are very mild." Javid took over last month from Matt Hancock, who resigned after breaching social distancing rules. Hancock fell ill with COVID-19 early in the pandemic last year, and British Prime Minister Boris Johnson spent several days in intensive care with the virus in April 2020. Britain currently has higher rates of COVID-19 than France, with more than 51,000 new infections confirmed on Friday, the biggest number for 6 months. Hospitalizations and deaths are also rising, but remain far lower than at previous infection peaks. Despite the soaring cases, remaining restrictions are set to be lifted in England on Monday, though the government is advising people to remain cautious and continue social distancing. Face masks will still be required on London's buses and subways and some other transit networks. In an announcement late Friday, the UK government said people arriving from France must self-isolate for 10 days on entering Britain, even if they are fully vaccinated. The announcement came just days after the government said fully vaccinated UK residents will no longer face quarantine starting Monday when arriving from dozens of countries classed as amber or medium on Britain's traffic light system of coronavirus risk. The amber list includes the United States, Canada and much of Europe. British health authorities say France is being singled out because of cases of the Beta variant, first identified in South Africa, which is believed to be more resistant to vaccines than other strains of the virus. The Beta variant accounts for about 10% of cases in France, but much less than 1% of cases in Britain. In both countries, the Delta variant first identified in India is dominant. Epidemiologist John Edmunds, a member of the UK government's scientific advisory group, said there is good evidence that Beta can evade the immune response generated by the AstraZeneca vaccine more efficiently. The AstraZeneca shot has been used for a majority of British vaccinations. Before the pandemic, more than 17 million UK residents visited France every year. Gemma Antrobus from the Association of Independent Tour Operators said Friday's announcement had taken the travel industry by surprise.